All right, I think we're live. I'm trying something a little bit different. I actually have posted this news to YouTube, not YouTube, to Twitter and to Facebook, and I thought, why don't I just take 5 minutes or less and just make a video? This is a very different. I've been doing some health videos. I really haven't done a whole lot on the coronavirus. I've been trying to stay away from it. YouTube has been really slapping channels around for it, and I don't want to be accused of doing false news here or fake news or whatever. But I know this is tech startups, but the president just spoke about this. This is exciting. I'm not sure why it's all kind of messed up, but new controlled clinical study conducted by doctors in France, and I'm not going to try to. It's hydrochloroquine, I guess, 100%. And what I like about this is it apparently clears out the entire virus out of the system. It just doesn't just treat the symptoms. Earlier today, we published a story about a new study published by NIH, which shows that the hydrochloroquine has been found to be more effective and potent than the chloroquine in vitro treatment of coronavirus. While the media is focused on the vaccine race and leaving the discussion of therapeutics almost completely neglected, there's far more money in vaccines. That's part of it. A recent well-controlled clinical study conducted by Didier Roland, I guess, Didier et al. In France showed 100% of patients that received combination of HCQ and another drug I'm not going to try and pronounce tested negative and were forget it. 6 days. In addition, recent guidelines from South Korea and China report the same kind of thing. So this is 3 different countries that have now said, hey, which of course means the U.S. is probably not going to do it because they didn't invent it. I don't know who makes these drugs. That would be a good thing to go. I know the stock market is now on a rally after the president got done talking. A therapeutic agent that prevents infection with novel coronavirus is highly desirable, especially for persons with high risk exposure, as well as persons with I can't, Okay, so basically, it's a fairly mild drug. So if you got heart disease and other things, it's not going to really, because sometimes the cure is many times worse than the disease. Groundbreaking in vitro studies demonstrate potential efficacy of hydrochloroquine as a prophylactic for novel coronavirus infection in primate cells. Is inexpensive, globally available drug tablet that was approved for widespread medical use in 1955. So this is really good. The sales are probably going to go up. It is not an over-the-counter drug. It is a prescription drug, but it's already been in use for, what are we talking here? 65 years, basically. This is awesome. So hopefully this is not a hoax. Hopefully this is real, and people will start to get these drugs. And I think we're gonna, because if this is real, this thing's over. Basically, it's just nothing. Only thing left is the twitching. We can get back to normal life tomorrow. Get the people who are sick. I think the biggest problem right now is going to be testing. Is getting people tested, at least here in the U.S. for various reasons. I'm not going to point any fingers, but we're starting to get some mobile test things here in Cincinnati. Not mobile, but semi-mobile. You got to go to it. But if in particular, this might be a case as a preventative your agent that prevents infection. So if you're a healthcare worker, you're working in a hospital, doctor, nurse, corpsman, doesn't matter. Orderly, everybody, give this to everybody. I don't care if they got symptoms or not. Give it to them, and obviously deal with the sick. Deal with people who do show symptoms, and give it to everybody else in the hospital. All of your EMTs. And just go on down the line, and this thing will take care of it. This thing will be done in 2 weeks. I mean, completely. What I don't know, it doesn't say in here, is if people have severe, at what stage is it not? Is there a stage where this is just not going to be enough quickly enough? I don't know. If someone's on a respirator or ventilator, does this help? And we do have in vitro, and so we could cure the babies too. And like a typical commercial drug, the objective of the group is to share trial data from the public and as close to real time as possible. Given the rapid spreading coronavirus pandemic, the group is looking for every possible means to fast track the effort. You can read about the draft paper here. So anyway, Anyway, this is I wanted to just quickly kind of put this out there. I know it's I had a whole nother thing I was going to do for this morning's video, and I didn't do it last night. I had a horrible night sleeping, and I was up at like 1 o'clock in the morning. I thought I might as well make it, but I didn't. About mental health and diet, I will hold that one for tomorrow. So tomorrow morning's video, I'll probably make it later this afternoon, but tomorrow morning's video will be about mental health and diet. And this is fantastic news. I hope it's real. I hope that we can get this drug to everybody who's sick right now, all the healthcare workers, and then just start, maybe we just give it to everybody. And I think a vaccine is still a good idea, so that we can prevent it from coming back in the fall. Especially if it mutates, maybe the vaccine can have several of the mutations, and next year we'll be done with this and we won't have it return. So not only is this good news, and of course it's getting warmer, and that's going to help. And so maybe the quarantining can be done very soon, and businesses can get back to open and not fail. I mean, that's been my biggest pet peeve of all this, is there's lots of small businesses that are just going to go under. But hey, if we can get this out the next few days, and this is real, then maybe mid next week we can have some of these governors stop doing their illegal actions and get us all back to work and going. All right, so I have been Channel Day Brian Lape, or also known as Brain Muffin, as I am on here. So what do you think of this? You think this is good news? I mean, hopefully you think it's good news. Do you think it's a hoax? Do you think this is real? And how quickly can this drug be put out everywhere? I think this is fantastic, and it's some of the best news we've had yet on coronavirus. And it's this is, take it seriously, but this would be awesome if this is 100% right, and we can get this cranked out there, get people who are very ill better, people who are high risk of exposure because of medical, their profession, get them treatments so that they don't get it, and then let's just get on with life. All right, thank you very much, and we'll see you. Goodbye.